But we know it is so much more than that. Medicaid is school nurses, is children's allergy and prescriptions, is IEPs for students who need behavioral and mental health support. Medicaid is emergency medical services and EMTs. Medicaid is care for seniors and people with disabilities. In Pennsylvania, Medicaid is the primary payer of home and community-based services, of substance abuse disorder services, of mental health services. And for families in need, Medicaid makes up the difference when private insurance and Medicare don't go far enough. In Pennsylvania, Medicaid covers 1 in 2 children. 1 in 3 births in Pennsylvania paid for by Medicaid. Almost 1 in 4 adults. 1 in 10 veterans. I could go on. In Philadelphia alone, more than 670,000 people, most of them children, receive Medicaid services. Now, our union, SEIU Healthcare Pennsylvania, we represent hospital workers. 15% of hospital funding, that is 1 in 6 hospital patients, paid for by Medicaid. Our union represents nursing home workers. 63% of nursing home funding, that is 5 in 8 nursing home residents, paid for by Medicaid. And we represent home care workers. 100% of home care services are paid for by Medicaid. Any cuts will be absolutely devastating. But they say waste, fraud, and abuse. We have to make cuts. And why? So that a few rich people can make even more money? Any cuts to Medicaid, any changes in enrollment and the Medicaid requirements, even small changes, will take healthcare away from hardworking families. And I just recited to you some big numbers, but it is important for us to remember that behind every single one of those numbers is a life, is a real person, is a family, is a child with special needs, or a senior with disabilities, or a single mom with 2 jobs whose private insurance doesn't cover the prescription she needs to get by, or a family struggling to get the best care to live the best life possible. And yet they see waste, fraud, and abuse. Shame. Let's be clear. Let's be clear. Medicaid is wildly efficient. It is the most effective and cost-effective way to provide and pay for care. It is less expensive and it is more cost-effective than both private insurance and even Medicare. In short, Medicaid works. And yet, they say waste, fraud, and abuse. Waste, fraud, and abuse. Boo! Shame! You want to talk about waste? Let's talk about Medicaid work requirements. Forcing someone who's already working to fill out more paperwork and meet more deadlines just to prove that they are, that sounds like waste to me. What about you? The vast majority of Medicaid recipients are currently working. The rest are retired, caring for others. They're people with disabilities or who are currently in treatment. We are working. When they say work requirements, let's be clear about what they mean. They mean paperwork requirements. And if the idea of making it harder to apply for or maintain your healthcare coverage by making people jump through additional meaningless bureaucratic hoops sounds wasteful to you, you are not alone. And don't take it from me. They've actually tried Medicaid work requirements in Georgia. And you know what happened there? Families lost coverage, and it cost more to administer the work requirements than they saved in implementing them. That is waste. Does that sound like waste to you? All right, waste, fraud, and abuse. Fraud. Okay, how about fraud? How about the fraud that Elon Musk is pulling on the American people right now? The unelected richest man in history chainsawing community services for families so that he can increase his profit margins. That's fraud. Stealing families' health insurance to put more money into the pockets of the richest billionaires and corporations in America, that's fraud. Shame. Waste, fraud, and abuse. You want to talk about abuse? What about the abuse of ripping healthcare and mental health services away from children? What about the abuse of ripping away in-home services to allow seniors to age with dignity in their own communities? What about stripping away prenatal, postnatal, maternal health services for millions of families? That's abuse! If you want to find waste, fraud, and abuse in America, you don't gotta look far. But you shouldn't be looking at hard-working Medicaid recipients. We should be talking about the bosses and billionaires at the top who exploit our good work and our values to make a quick buck. We should be talking about the corporate tax dodgers and the extractors who will burn this world to the ground if it means an uptick in their private stock portfolio. When they scapegoat working people, when they say waste, fraud, and abuse, when they say Medicaid work requirements, you should hear what they mean. They mean less for us and more for themselves. Higher profits for them and less for everybody else. But we're not gonna take it. Are you gonna take it? I am honored and proud to be here with you in this fight. SEIU is with you every step of the way, and we are not gonna let up. We will keep fighting in the streets, in the halls of Congress, and anywhere decisions that are made are gonna affect working people. We are with you, and we're not gonna stop. When they say cut